Thank you. At the top of the briefing, you made a statement about that the Democrats are interested in giving health care to illegal immigrants.
Yes, they are.
U.S. law already prohibits that. It's a 1996 law saying that they cannot give unauthorized immigrants any federally subsidized health care coverage through Medicaid, the Affordable Care Act, or the Children's Health Insurance Program. There seems to be a disconnect in the messaging.
Are you denying that Medicaid money has never gone to illegal aliens in the United States of America?
I'm not denying anything. I'm asking you if you can explain the disconnect in the message.
I most certainly can. The Democrats' proposal, their continuing resolution, let me just reiterate, the Republicans' continuing resolution was a clean continuing resolution. There was no partisan politics injected into it. There were no conservative wish lists injected to it. What the Republicans want, and still want to this very second, is a clean continuing resolution to fund the United States government. What did the Democrats want in their continuing resolution? They inserted a provision to undo a provision in the Working Families Tax Cut, the One Big Beautiful Bill, that ended taxpayer-funded health care illegal benefits for illegal aliens. Democrats' proposal would require Medicaid to pay more for emergency care provided to illegal aliens than Medicaid does for American patients who are disabled, elderly, or children. And this bill would have also allowed California to continue a gimmick that funds its Medicaid for illegals program. Those are things that we ended, the Trump administration ended, with the passage and the signage of the One Big Beautiful Bill. And it is an undisputed fact, a fact that under the Biden administration, illegal aliens were absolutely receiving taxpayer-funded health care benefits. In fact, in fiscal year 2024, Medicaid costs for emergency services for illegal immigrants skyrocketed by 142% from the previous year to $9.1 billion. That's $9.1 billion taxpayer dollars that were going to emergency services for illegals. Between President Trump's last full fiscal year under his first administration and Joe Biden's last full fiscal year, Medicaid spending on emergency services for illegal immigrants nearly tripled. There was an increase of 196% between 2020 and 2024. And I have a chart here for you, and I'm more than happy to email it to you. I'd also like to add, because some were asking dishonest questions yesterday about emergency rooms. In Southern California, according to healthcare professionals in 2023 under the Biden administration, Southern California's, quote, entire healthcare system was being bombarded with illegal immigrants and forcing American patients to endure longer wait times. In Denver, Colorado, the CEO of Denver Health stated that 8,000 illegal immigrants made 20,000 visits to the city's health system in 2023, leaving an uncompensated bill totaling over $10 million. So when an illegal alien goes to the emergency room, who's paying for it? The American taxpayer. The main safety net hospital in Denver had to turn away patients due to the massive influx of illegal immigrants into the community, and UC Health Hospitals in 2024 reported their system was under stress from an increasing number of migrants. As a result, according to the head of emergency departments and urgent cares across the hospital system, quote, access is impeded for everyone. These are healthcare professionals who dealt with this directly, and there's a lot more where that came from. It is an undisputed fact that Democrats want to give taxpayer-funded healthcare benefits to illegal immigrants, period.
All right, let's talk about the viral moment blowing up online. A tense exchange where Karoline Leavitt challenges a reporter with one loaded question. Are you denying that Medicaid money has never gone to illegal aliens in the U.S.? And the room got real quiet real fast. This isn't just about one question. It's about immigration, healthcare costs, media credibility, and political spin. And honestly, the way people react to that one sentence says more about the country than the clip itself. So let's break this down not like a news recap, but like a real conversation. In the clip, Leavitt confronts a member of the press during a briefing or interview-style setting. She accuses them directly of ignoring or denying the possibility that Medicaid funds have been used to support undocumented immigrants. The reporter pushes back, trying to clarify or reframe the question. But Leavitt keeps drilling the point: taxpayer dollars, Medicaid, and immigration status. Whether she's grandstanding or exposing something real, that's up for debate. The moment isn't just fiery, it's strategic. She wants the question itself to do the damage. Now, let's talk about why this moment hits differently depending on where you stand. So here's where I'm at with this. The line she used, "Are you denying?" is meant to corner the media. It's not just a question. It's a political weapon. And you can feel it in the tone. She's not asking for facts. She's demanding acknowledgement. And let's be real. The topic of whether undocumented immigrants receive government health care benefits is one of those lightning rod issues where facts, perception, and politics all get tangled. Now, some people will hear that clip and think, good, finally someone's calling out the media. Others will hear it and go, that's fear-mongering. Medicaid fraud is rare and tightly regulated. But here's what I think is being missed in the shouting. 1. There's a difference between what the law says and what happens in reality. Federal law makes it clear. Medicaid is for citizens and certain legal residents, with emergency exceptions. But is it possible that funds get indirectly used on undocumented migrants through hospitals, public health systems, or state-level programs? Yeah, absolutely. So, is the question valid? Yes. Is it being asked in good faith? That's where people split. 2. She knows this isn't about proof. It's about perception. This moment wasn't about policy nuance. It was about planting doubt and forcing a yes or no answer to a massively complex system. That's political communication 101. If the reporter says no, that doesn't happen, she'll say they're lying or covering. If they say, yes, it happens, it becomes a headline. Reporter admits Medicaid funds go to illegals. See how that works? 3. This is part of a bigger election year strategy. You're going to hear the phrase illegals and your tax dollars nonstop for the next few months. Whether it's Medicaid, schools, or housing assistance, the narrative is being built brick by brick. This clip is just one of those bricks. Now I want to hear from you. Do you think Medicaid funds are being used directly or indirectly to treat undocumented immigrants? Should that be allowed in emergency cases? Or is this all just political theater meant to stir outrage without offering solutions? Because here's the real question no one's asking in the clip. If someone shows up in an ER with no insurance and no legal status, do you refuse treatment? Should hospitals eat that cost? Should taxpayers? Or do we just pretend it doesn't happen? That's the debate, not just a soundbite. For me, the bigger issue is honesty. Don't act like the system is airtight. It's not. But also don't pretend every dollar is being drained by undocumented folks. That's not reality either. The truth is somewhere in the messy middle, and politicians love using the messy middle as a weapon. If you found this breakdown helpful, or you're ready to argue with me in the comments, hit the like button, subscribe, and drop your take below. I want to see where people land on this because, trust me, the conversation around Medicaid and immigration is about to get a lot louder.